Thank you. Let's make it bigger when I'm done, please. All right. Hello, everyone. My name is Aisha. I'm a Nigerian, a psychologist, and a social change maker. And I'm going to walk you through our story and what we do. And obviously, as you can see this quote, I think it's giving away my topic. It's mental health, a topic that's very sensitive for the world, but often very neglected. And alarmingly, every 40 seconds, someone in the world dies by suicide, which means that in the past 1 hour that we've been here, at least 10 people would have taken their lives. And most suicide cases are associated with mental health issues. These deaths mostly occur in low and middle income countries like my country, Nigeria. 77% of these deaths are from low and middle income countries who normally have issues with access to healthcare. So you can imagine the bottom where mental health care is, regardless of the pressing need that mental health is. The Sunshine Series is the name of my organization, and we're trying to change that narrative, and we're trying to change that poor access by improving access to quality mental health care in Nigeria and sub-Saharan Africa for now. And we're doing this through a systems change approach and community involvement, which is what I am going to gradually highlight as I continue. But why is the Sunshine Series work important and relevant? In Africa, there is a ratio of less than 2 mental health workers to every 100,000 people, which means that when people need mental health care, they cannot even access it, as life-threatening as it is. Nigeria, the largest black nation in the world, has over 200 million people, but we have less than 300 psychiatrists for this population. Psychologists like myself are estimated to be less than 1,000. So no matter how pressing the mental health need is, we are still unable to match the need. Our audacious goal is to reach 1 million people by 2030. Not just reach 1 million people with words, because I think we have already done that, but reaching 1 million people with access to quality mental health care with ease, without difficulties, without barriers that block people from accessing this needed care. And how do we plan to do this? We are just the starters, but the responsibility to make this happen is our duty. Everyone in this room, everyone in the rooms that you have left at home, at your workplace, within your community. So this message is not just relevant for everyone sitting here, but for every community that we all belong to. We are leveraging partnerships that scale, partnerships that make things happen on a large scale. If Nigeria alone has over 200 million people, I alone cannot provide mental health care to even 100,000 people given 5 years. And that's why we're leveraging partnerships that make our work happen on a larger scale. We train community lay counselors. Community lay counselors are people who are trusted by their communities, like healthcare workers, religious leaders, traditional leaders. We train them to be able to screen for common mental disorders, be able to offer counseling, and make referrals for severe cases. So far, we have trained over 700 lay counselors who are working in NGOs, in refugee camps, in primary healthcare centers, in schools, in communities, in religious centers, and our target is to train at least 3,000 of these people by 2030. We also launched the largest mental health helpline in Africa in collaboration with the federal government, partnerships that scale. The federal government has an emergency number called 112, which is the equivalent of 911 in the US. In partnership with them, we are able to provide mental health care 24/7, toll-free to callers. We also work with the government to influence policies, because every change you want to make, the first barrier is, where are the policies? So as critical as mental health care is, you still need policies to make it happen. And that's where we work with them to shape these policies, influencing access to care for at least 40 million Nigerians who currently live with mental health conditions. Now, I would say, is this enough? it's still not enough. We haven't scratched the surface of the problem or the solution. But we have to figure out ways to ensure that the partnerships that we have cultivated lead us to a larger pathway to scale our interventions. And for that, we are launching very soon a mental health app that's going to connect Africans around the world with culturally relevant mental health care. Something that's sensitive to their cultural identity, who they are, how they talk, and how they want to receive support. We're also going to integrate this app into our primary healthcare centers, which is usually the first point of contact for most communities, starting with Nigeria. Nigeria has over 30,000 primary healthcare centers, but majority of them have no mental health awareness or services. By integrating the app, we're removing the technological barriers that would ensure that the fact that you do not have internet or a smartphone, you do not have access to mental health care. And then we're going to launch the app to target Africans in the diaspora. And what this does for us is it ensures financial sustainability, right? If Africans in the diaspora who have the purchasing power to access mental health care can afford to pay for it, it has a ripple effect of ensuring that someone in rural Nigeria who does not have access to the financial means to get quality mental health care can also receive the services free. Our journey in 5 years, so far we've hit 5 years of impact, but we have more years. Thank you. But we have more years of change to make, and this work has only been possible with our partners' support and an incredible team that's passionate, that's had the lived experience, that's part of the problem and wants to see the change happen. And my call to action for you is just like how I started. My message is not just for you sitting in this room, it's also for the person who is not sitting in this room, the members of your family, your school, your office, your community, everywhere. We need to ensure that everyone has access to quality mental health care without barriers. Thank you so much for spending this time with us, and I will